What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, March 1st, 2024. If you're new to my channel, we talk about the COVID pandemic every day. We do daily pandemic updates, and we talk about other viruses that could be a threat to you. Today, we're going to talk about major changes the CDC is making and new variant data that just came in for COVID this week. So if you want to subscribe to my channel, hit that subscribe button down below. If you like these videos, give it a thumbs up. If you want more people to see my content, by all means, share this with them. Alrighty, we have to talk about these major guideline changes because it is really, it's getting a lot of people mad. It's got me mad. I already did a poll on Twitter. I said, give it a thumbs up or comment down below if you're angry with if you're mad about the new CDC guideline changes. Last I checked, it had hundreds of thumbs up. It had quite a few comments already. People are not happy about this. What are these new guideline changes, you might be asking? Well, here's the breaking news of the day. CDC drops 5-day isolation guidance for COVID-19, moving away from key strategy to quell infections. Does this make any bit of sense to you? It makes absolutely no sense to me. Fair warning, I'm really mad about this, so you might notice it in my voice today, how mad I am about this. This is one of the most contagious viruses that we have ever seen. We've seen measles, which is also contagious. COVID is right up there, just as contagious, if not more contagious, but yet we allow it to continue to spread. Yet we allow it to mutate. You'll see in a moment. There's yet another mutation that has popped up from the JN 1.1 variant. I mean, this is totally ridiculous. Let's read on, shall we? It says here, the agency says it's updating its recommendations for COVID-19 to bring them in line with its advice for other kinds of respiratory infections, including influenza and RSV. Offering a single set of unified guidance will make people more likely to follow it. Oh, really? They're not following the guidance as is. Agency experts said in a news briefing on Friday. They're already not following the guidance, but come on. You need to make it easier for people to follow these dang guidelines, and plus, the guidelines that you just put into place, which I'm about to read, don't make any bit of sense to me. This is a very contagious virus. There are a lot of unknowns with this virus. One of the big unknowns is we still don't know who will and who will not get long COVID. Long COVID can really disable you. It has changed some people's lives forever. They've had to quit their jobs. They've had to lose their house. They've had to sell their homes because they can't pay their bills because they had to quit their job because of long COVID. And now you want to give the virus an upper hand and go out and say, well, if you test positive but your symptoms are improving, you can go out and enjoy your life. Okay. That's fine for that person, but what about the immunocompromised person that they're going to come in contact with? What about that person who, if they catch COVID, it could be really devastating to them. It could really be a major health emergency to them. No, you don't care about them. All you care about is the corporate world. Okay, got to get back to work. We don't have time for them to be positive with COVID. Oh, we don't have time for this. Business must go on. We gotta do the Simpson deal today, or whatever the case may be. Okay, let's read on. Namely, the CDC now says people who have COVID-19 should stay home until they've been fever-free without medication for at least 24 hours, or their symptoms have been improving for 24 hours. After that, it's fine to resume regular activities, agency experts say, but they recommend that people take additional precautions for the next 5 days, including improving ventilation, masking, and limiting close contact with others to lower the risk of spreading the virus. Okay, so if you did want to go down that route, are you providing the tools for people to do that? Are you giving them air purifiers? Or are you giving them proper masking? Are you telling them that, hey, them cloth masks don't do anything? That, hey, those surgical masks don't really do much? And that, hey, they should be wearing N95s or better? No, you're not doing that. You're just saying, you can go out and you do you, and, well, we're not going to really and force you to do any of these guidelines. We're just giving you suggestions of what maybe you should do because, well, we all know no one's really following the guidelines anyhow. That's true. Now, Oregon and California, they have already done one of their own things, and CDC claims there has been no increase there. Fine. The point being made here is it just takes one infectious person to infect one immunocompromised person or one person that's completely healthy. I mean, this happens too. There's some people that are completely healthy. Then they get COVID and their life gets completely turned upside down and they have not returned to a normal, healthy life ever since their COVID infection. Yes, that happens. It still happens at random. We don't know why. And it's going to be a long time until we know why. What would be more effective? Well, maybe if they told people that if they test positive for COVID, they stay home until, these rapid tests that we're using, they stay home until they don't have immediate positive results on the rapid test, and even better, preferably, test negative. If you're getting an immediate positive result on a rapid test despite symptoms, that means you are shedding virus and you are super infectious and you could infect other people. Let's face it, people who are positive with COVID right now, there are a large majority of them that don't bother to stay home as is. They go out, they don't even bother to wear a mask. You hear them coughing, and then they spread it to other people. We just had the second biggest wave of the entire pandemic. And let me make something perfectly clear. Cases, second biggest wave in wastewater being detected of the pandemic. One of the things the CDC says, they have a whole background. We're not going to sit here and read the whole thing to you. I've looked at bits and pieces of it, but some of the things that they say is, well, hospitalizations, they are down. Okay, wait a second here. Are you doing a thorough collection of data from hospitals? Are you requiring all hospitals to report that hospitalizations for COVID? No, it's not a requirement anymore. You notice here, we're starting to require there to be less data. We don't even have all 50 states coming in with reported COVID cases. When B&O does their update, I believe it's 20 something, I think it might be 28 states they have to do estimates from because they do not give weekly updates. I live in Pennsylvania. We can't even get weekly updates unless something's changed again. I haven't seen a weekly update from Pennsylvania in a very long time for COVID. And with hospitals not being required to report the number of positives they have in their hospital, how are we to know? Heck, hospitals going on admissions are not even doing testing for COVID anymore. I mean, some are, many are, but there's a large number of hospitals that aren't. I know some people that have gone to the hospital because they were sick recently. Maybe it was a respiratory virus, whatever the case was. They didn't even perform a COVID test on them. So how are we knowing how many people are actually in the hospital this winter? I mean, we do have the count from the CDC. We can pull that up here. Hang on, here it is. It dropped this week. It's down 10.3%. It's down to 17,310. But again, if not all hospitals are required to report, if not all hospitals are testing for COVID, how do we know that is even an accurate number? It's not an accurate number. So how can we say for sure that, oh, well, the hospitalizations are down this year? And guess what? COVID deaths. They've been over 1,000 a week since going all the way back to, what was it, September of last year? September of last year. That's really a long time. We weren't even doing 1,000 flu deaths a week in September of last year. So how is that anything like flu or RSV? And then long COVID. There's a new study that's out on long COVID. You know how we heard, oh, this whole idea that now there's long flu, and guess what? I'm agreeing. Yeah, there probably is long complications of flu. That is a real deal. But guess what? There's a new study to follow up on that. And it says long COVID is more severe than long flu. Do you know anyone with long flu that has had to sell their house, that has had to, I don't know, quit their job, go on disability because a virus has completely disabled them? Okay, there may be one or two cases here or there with long flu, but guess what? Long COVID, it has disabled millions of people. And now we want to give the virus the upper hand because someone who's positive, who is feeling better, whether they're still super infectious or not, can go out and about and enjoy their life with, telling them, hey, you need to wear a mask. Oh, yeah, 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 that's okay. It's like the doctor's offices that had masks required, but yet you see the receptionist sitting there with no mask on. It's pretty much the same thing. This whole you do you. We're pretty much emphasizing on it and making it even worse. All right, we have to talk about something else. It's Friday. Every other Friday we get a variant update. Look at this. I mean, we're just giving the virus the upper hand here. So JN.1 is at 92.3%. That actually dropped a little bit. And you might be asking, wait a second. I thought it would take something really big for that to happen. Well, I don't know very much about this, but there is now a couple more variants that have entered the picture. JN1.1 is at 92.3%. Then we have the brand new JN1. Let me say this again. JN.1.13, which is now at 3.3%. Yeah, that just randomly popped up. Will it become something? I don't know, but it has popped up. JN.1.18 is now at 1.8%. Then you still do have just a few variants that are below 1%. Yet again, another subvariant has been added to the family of subvariants. Could we go into variant soup with the JN.1 subvariants now? It's possible. I mean, as long as we allow this virus to continue to mutate because of poor guidelines put out by the CDC, not even just the CDC. There's other countries around the world that are starting to do this as well. The WHO has not been very helpful. It's just totally ridiculous. We're allowing this virus to continue to mutate. Let's take a look at some other data that we normally would take a look at, such as Philadelphia EMS totals for Friday, which, well, actually, this is Thursday, and 680 EMS calls. So that is down significantly from the day before, but it's been bouncing around all over the place this week. And let's just do a live look at Montgomery County. Montgomery County respiratory emergency calls. There's a few of them right now. I'm seeing 3, and I'm seeing 1 vomiting call. So that's not good. Sickness, it's still going around. Taking a look at Chester County, Pennsylvania, just 1 respiratory emergency at this time. And let's also take a look at some other CDC data that updated today. Wastewater, it's highest right now in the southeast, so that's not good. We'll have to continue to watch wastewater because with a new subvariant, such as that JN, let's go back again, what was that? JN.1.13, hey, that could do something, depending on where it rises the most. We may do a dedicated variant video this weekend. I don't know yet. We'll have to see here. A lot of these different regions have not been updating lately, or we just may add some regions into tomorrow's pandemic update. Let's continue on here. Do we got any other data? As shown here, the hospitalizations, they did update, and it's down 10.3%. And we can see here, yes, it does. You can definitely see there is less orange on the map, but there's still a lot of counties that are orange, which are still seeing substantial increases in hospitalizations. So that's not good. And when we look at New Jersey, it looks like portions of Central and South Jersey is where we're seeing some increases, which would explain maybe some of where the increases in New Jersey itself were coming from. But today they did come down. It's 492 hospitalizations, 23 people on a ventilator. In the ICU, 74. Discharges, 85. And let's quickly look at New York State. 1,328 people tested positive in the last 24 hours. And taking a look at this, hospitalizations didn't really drop all that much. ICUs did, but hospitalizations did not. 1,066 people in the hospital and 129 people in the ICU. All right, I'm not going to show you any other news stories today because that was a pretty big news story that we discussed. Again, CDC changing the guidance to if you're fever-free for 24 hours or starts to go down, guess what? You can go out in public, but hey, continue to wear a mask, which we know most people will not do because they don't take COVID seriously anymore. It's just totally ridiculous. I will tweet out some more links to this new updated guidance. You can see that there. My Twitter account is at COVID Data Report. And if you have an opinion about this, are you upset about this? Please leave a comment down below. I'm expecting many of you will leave comments today on this change in the guidance. I'm sure you've already read this before you have seen today's video, but hey, I just wanted to state my opinion on it. And I'm not happy about it. And once again, if I had my way, I would be telling people, as long as you are testing positive, guess what? You have to stay in quarantine because you could potentially be contagious and spraying it to other people. Putting it up there, right up there with flu and other viruses, is incorrect because COVID affects everyone differently, and we know long COVID can be more severe than long flu, which, ugh, anyone who is dealing with long COVID, the CDC basically just insulted you today. They did. They really insulted you today. Alright, guys, I'm not going to ramble on about this any longer. I could go on for a very long time. Not going to do that. I think my point was made today. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you want to share this with anyone, by all means, share this with them. A note about tomorrow. We are going to be doing tomorrow's pandemic update. As usual, we're going to be start using a different browser. Having a little issue when we show some of these news stories. You notice the videos play. Well, I use Google Chrome a lot, and Google Chrome does not have a disable auto play feature anymore. I found another browser that does. We're going to use that. Hopefully that works, and maybe it's not so distracting with this other stuff that pops up in the middle of me trying to show a story. Alrighty, guys, I'll see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and thanks for watching. Try to stay safe, anyhow. Have a great Friday evening.